I changed the settings this time, so the attendees are sitting over in a waiting room until we're ready to go. Give me a thumbs up if you all are ready, and I'll get TBW to start, and then I'll let the media in.
I'll be ready in 30 seconds.
Sounds good.
And I'm ready.
A second here, I'm trying to get them in the room. Good morning and welcome to the Wednesday, March 16th, Washington State Department of Health Media Briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Lacey Fehrenbach, Deputy Secretary for Prevention and Health, and Michelle Roberts, Assistant Secretary for Prevention and Health. To begin today's briefing, we'll open with remarks from Secretary Umair Shah.
Thank you, Nikki. Can you hear me okay?
We can hear you.
Great, thank you. I want to start again, as we always do, just by thanking all of our media partners for being here today. I did want to also thank all those who have reached out to me and my family during this difficult time. I want to particularly thank our Department of Health team here for being there throughout this challenging time. As you may be aware, I lost my mother less than a week ago. She was with a spirit like no other who taught the importance of compassion, love, and doing for others. She had a hemorrhagic stroke 30 years ago and came home in March of 1992, and she has lived with us all these decades. I learned so much as a healthcare provider, as a physician, as a son by taking care of her and my late father. Though in a wheelchair, she lived life and traveled the world, inspired so many in the community, and we miss her. Taking care of her was not easy, as you can imagine. Being an advocate for someone you love despite all the odds is very difficult. And I want to send a message to our Washington community members who too have taken care of their family members, their loved ones during this very difficult time. I know how it feels because I have just done that myself and have been doing that for a long time coming here. It's not easy. It certainly takes a village of family and friends and loved ones and coworkers who step up. And every single day, I know how difficult that has been and how difficult that continues to be. I also want to thank our healthcare providers, whether in Ohio or Texas or here in Washington, for just being what they do, the incredible spirit of being able to care for people and heal them despite all the odds. Doctors, nurses, and I particularly want to thank Barbara and Teresa, who took care of my mom with joy and compassion at the very end. Therapists, care aides, technicians, nutritionists, and everyone else involved. It takes a true village, as I said, to take care of somebody. And I just want to thank all of them, all of our healthcare providers who do something every single day for our loved ones, regardless of what it is that they're going through. Again, I want to thank all of you for your words of encouragement and support throughout Washington. It has meant so much to me individually, but also to my family collectively. I understand that as we're making our transition out of response and recovery here in Washington, our attention is shifting to other public health issues across the state. We're also monitoring and seeing what's happening across the country and across the globe. I would be remiss if I did not mention the conflict in Ukraine and continue to say that our hearts are with those impacted by that conflict, but in particular those here in the state of Washington who have loved ones who are impacted by that conflict as well. We, from a COVID-19 standpoint, wanted to come together today to really talk about what we're seeing here in the state and across the country. I mean, the good news is that we are seeing a trajectory of our cases on the decline. We certainly are seeing hospitalizations also decreasing as well related to COVID-19. And some hospitals continue to be stretched and as they manage many issues, including delayed care. We know healthcare capacity is coming back, but it's going to take some time, and there's a lot that's having to be managed in the healthcare system. I've seen it firsthand over the last couple of months, as I mentioned, with my mother's care, but I will also mention that we know that it's happening across the state. We're also seeing the slowing pace of the pandemic, and I know that reflects, as you all know, the rapid recovery that we are hoping to see over time here in the state of Washington and across the country. That means that, as you know, on March 11th, ending March 11th, we had the statewide mask requirements that went away. Now, You certainly have the potential for mask policies in local health jurisdictions, individual businesses. We want to continue to make sure that people respect those who choose to wear masks, and certainly respect the rules or the policies or the protocols that businesses or communities may put in place. Do everything you can. I will tell you, as I was dropping off my daughter this morning to school, it was also, good for me to see that there were some kids who had made a decision with their parents not to wear a mask, and there were other kids who had made a decision with their parents to wear a mask. Regardless, respecting the decision is really what we would ask all of you to do. So I've just given an overall overview that things are better, and we're glad to see that in the state of Washington. What I'm going to do now is to turn over to Dr. Lindquist, who's going to provide the epi update, and then Michelle will provide a vaccine update. And then I will join Lacey Fehrenbach. Lacey and I are going to talk about the WA Forward plan, the plan for Washington. As you know, the governor had alluded to this a couple weeks ago, that we were going to be releasing the plan for Washington, and that's what we're going to discuss and describe at a high level this morning. And so Lacey and I will come back and do that after Scott and Michelle complete their remarks. So with that, Scott, I will turn it over to you.
Great, thanks. Thanks for those positive comments. Very much in the spirit of your mom. Appreciate it. So one thing I want to talk about is what the cases look like here in Washington. So when we look at the epi curve for Washington State, we'll see, so if you could put up that first slide. Yep, you can see here the many waves we've had since the beginning. The more the wave shows big impact, like this last wave or the sixth wave, the smaller it makes the previous waves. I have to remind you, this very first wave, way back in winter of 2020, felt huge. That was a huge wave. It looks tiny on here. I don't want to underestimate that. That was a pretty big wave. Second wave large, third wave even larger, fourth wave, fifth wave, where we got to know new variants. And then this sixth massive wave, you can see this was a very infectious variant, Omicron. And we have brought these levels down in Washington State, lower than some of previous waves. So this is all what Dr. Shah is talking about. It's all very positive. And put this in the context of what we are hearing internationally, where they're having a surge in cases again in Europe. About half of all countries in Europe are having an increase in cases. We are not seeing that here in the United States. We're not seeing that here in Washington, but this is the kind of data that we're looking at very carefully. And then when we look at our hospitalizations, that usually follows our case counts. And indeed, we're seeing the same pattern here, wave 1, 2, 3, 4, 5, and then this very large wave number 6. Now, it wasn't due to the fact that more hospitalizations occurred with this variant Omicron. It was just the sheer number of cases was so high that the sheer number, even if it was lower for hospitalizations, was going to rise too. And again, you can see that our hospitalization rates are down, well below where they were at this peak, but certainly in the era of some of these previous waves. So this is all very promising information. Now, death cases tend to follow by about 3 weeks the actual trajectory of cases and hospitalizations. And again, even though this was not the most deadly variant, because of the sheer number, we did see an increase in a spike in deaths, as you can see in this wave. But again, coming down in those numbers, and the gray bars here to the right are incomplete data, but has all the indications that our deaths are decreasing. Now, one of the obvious things as we're watching Europe and parts of Asia go through increasing cases again, is this a new variant? And the quick answer to that is our variant analysis this week showed that we have no new variants. We do have this subvariant, BA2, which is the Omicron variant, essentially. It's a sub of that, but our numbers and our percent of that subvariant remain less than 7%. So we are remaining very low in our subvariant. It is not becoming the dominant force, and it is certainly not driving an increase in cases. So with that, I turn it back to you and to Michelle Roberts for vaccine updates.
Thanks, Scott. Michelle?
Thanks, and good morning, everybody. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and implementation. So I'm just going to give a few quick updates on where we're at with our vaccination efforts as they continue across the state. So first slide. We've given out more than 13 million doses of COVID vaccine to more than 5.8 million people. Vaccination is continuing every day across the state, even though it's at a slower pace. Every day, so next slide, please. Every day, more and more people are protecting themselves by getting a booster dose of vaccine. We've given out nearly 2.7 million booster doses, which means nearly 60% of the population who is eligible for a booster dose is up to date on their COVID-19 vaccines. As a reminder, next slide. Everyone aged 12 and older should receive a booster dose at least 5 months after their second dose of Pfizer or Moderna, or 2 months after getting the single shot of the Johnson & Johnson vaccine. It is incredibly important for everybody to stay up to date on their COVID-19 vaccinations. This is our ongoing best protection against serious side effects of the COVID-19 vaccine. So there still is some people who are eligible out there in our state, and we encourage you to get in now to get vaccinated. You can take the slides down now, and we'll come back to this one. For some, we also want to share that a fourth dose could be on the horizon. Yesterday, Pfizer and BioNTech asked the FDA for emergency use authorization of an additional booster dose of its mRNA vaccine for adults 65 and older. That population continues to be the ones at highest risk of severe side effects and death from COVID-19. According to the vaccine manufacturer, the additional booster dose could curb infections and serious illnesses in this high-risk age group. The submission is based on 2 real-world data sets from Israel, analyzed when the Omicron variant was widely circulating. We know COVID-19 vaccines offer powerful protection against severe illness, hospitalization, and death, and that boosters extend that protection. This submission to the FDA by the manufacturer is just the first step. There are several steps still ahead, including review from the FDA, CDC, and the Western State Scientific Review Work Group. We will continue to follow their guidance and recommendations, and we'll update you as soon as we have additional information to share. So last slide now. And I just want to close by reminding everybody, getting vaccinated and staying up to date on your vaccines continues to be the best protection for yourself and those around you from COVID-19. To find vaccine locations near you, visit the state's vaccine locator website or the federal site at vaccines.gov. If you have questions or need help making an appointment, we're here to assist you. You can call the state's COVID-19 hotline at 833-VAX-HELP. Thank you.
Thanks, Michelle. Really appreciate both you and Scott being here with us for all these months. And it really has been a journey of a year and 3+ months, 15 plus months here on this vaccination road. So thank you so much for your leadership, and congratulations on your new permanent position. So congratulations, Michelle. As I mentioned, Lacey and I are going to now talk about the WA Forward plan. I'm pleased to announce that Department of Health is going to be releasing our WA Forward plan, and we will be providing this out by tomorrow. So I just want to make sure that our media partners are aware that this is going to be in your hands by tomorrow. As we have discussed, things have improved in our state, and it is absolutely a time to move forward. WA Forward is just that plan, and the one that we have really been working on and have laid the groundwork for quite a bit of time now. And I really just want to say, it has absolutely been informed by looking at what other parts of the country and the globe have been doing, and also taking an approach that works for Washington. So taking the best of what we've seen across the country, but also making sure that it's specific to what the needs and the future needs are of the state of Washington and Washingtonians. It's a long-term forward plan to keep people, families, and communities safe, protected, and healthy as we move to this next phase of the pandemic, while continuing to monitor COVID-19 across the country, the globe, and certainly here in Washington itself. The long-term response focuses on 3 elements, and I would say that they're empowerment, prevention, and readiness. And as Michelle has mentioned, we've, more than anything else, this real vaccine ability to get people vaccinated across the state of Washington, with 13 million plus doses that have been administered across the state, leading to one of the highest vaccination rates in the country and one of the lowest death rates among states as well. This is really important for us as we continue to not just look at the future, but also remember all the important lessons that we have learned throughout this last 2+ years. The WA Forward Plan, and if Nikki and Shelby, if you guys can just pull up the slides here, I'm going to talk through the 3 focus areas. The WA Forward Plan has 3 main themes with the focus areas. The first is engagement and empowerment. And this is really about what we can do with communities and businesses and families and individuals to stay safe and protected. And certainly it's guidance and information that we're providing, and also the steps that people can continue to take to be safe as we move forward. The second element is prevention, tools, and access. And this is really very much focusing on all those tools, from vaccines to PPE to tests, everything that we have really found to be so critical in this past road for us to continue to have access to as we move forward. Number 3, system readiness, support, and capacity. This is focusing on data monitoring, disease detection, but also what's happening in our healthcare system, and certainly treatments and therapeutics that are a part of that as well. All of these elements are supported with a series of commitments, 7 of them to the people of Washington as we move forward. What we will be doing behind the scenes to assure the health and protection and well-being of communities and individuals and the people that are within those communities. These elements focus on what we have experienced, what we have learned, and what has worked. It also prepares us for the future, regardless of what that future brings. I want to thank the governor for his leadership. I want to thank his team for always being supportive of our Department of Health team. I want to thank our partners at state agencies across the state, our local partners who have been there, and certainly I want to thank them for their input and support. I also would be remiss if I did not thank our Department of Health team for their efforts in putting this plan together. This has not been an easy plan to put together, a lot of moving pieces, a lot of elements to this plan, but we do believe that this is going to be very important for the road ahead. Most importantly, I want to thank Washingtonians for continuing to be on this road together. This is truly about hope, healing, and the horizon ahead. Obviously, the forward plan can be adjusted as needed, but these areas of focus, as we have laid them out, will carry us through the next several months. The forward plan will also help guide us into, as we've all talked about, coexisting safely with COVID-19 for the foreseeable future. So I've given a very high-level look at the plan, very high-level look at the 3 elements of the plan, and certainly the sub elements of this plan is absolutely critical as well. So let me now turn it to Lacey, who's going to talk both again about the high level elements, but also some specifics to those, and then may have some additional messages as well on the road ahead. So with that, Lacey, I'll turn it to you.
Thank you, Dr. Shaw. Good morning, everyone. Thanks for being here. I am going to share a little bit more detail about each of those 3 priority areas and what our plans are for the next several months. I'm going to start with engagement, education, and empowerment. Our main priority at the Department of Health continues to be ensuring the health and safety of everyone across the state of Washington. This plan is a plan for individuals, it's a plan for families, it's a plan for communities, it's a plan for Washington. Where we have been successful as a state in navigating this pandemic, it has been because we have all come together for the common goal of protecting health, the health of our families and the health of our neighbors. As we go forward, we'll be focusing on healing, building resilience and connection, and staying safer while COVID remains with us, as you heard Secretary Shah mention. DOH will be monitoring the science and providing people and organizations across the state with the latest health information, guidance, and resources so that individuals, school leaders, child cares, and early learning centers, businesses, and community leaders can take measures to protect themselves, their households, their communities, and help us go forward together. The second area is prevention through vaccines, testing, and masks. Vaccines remain the most powerful tool available to us to prevent serious illness, hospitalization, and death from COVID-19. Our goal will remain to be making vaccines widely available, whether that's the primary series or booster, and accessible to all Washingtonians, no matter where they live or who they are. We have a particular focus on closing our equity gaps through initiatives like caravans. In just less than a year, DOH has supported more than 700 community-led caravan vaccination events, most of these in areas of the state that have high social vulnerability and risk for COVID-19. We will maintain the capacity to give out about 30,000 doses of COVID-19 vaccine daily, and we could surge to double that amount within about a week if needed. Vaccines are very readily available across the state today. Please get vaccinated if you haven't already done so. Testing is another key public health tool and a critical component of our path forward. We've already distributed more than 8 million at-home tests, and we're continuing this work and expanding access through efforts like the Say Yes COVID Test program. You can order a test today if you'd like, up to 2 kits per household per month, and we will continue distributing tests through partners in local public health, tribes, schools, and other organizations trusted by the community so that people have access to testing when they need it. We'll also ensure access to diagnostic testing for people who need that and to facilitate access to treatment for COVID-19. Masks remain an effective way to protect yourselves and others from COVID-19, as well as other respiratory viruses. And even though masks are no longer required by the state, we still recommend them as an additional layer of safety. If you or your family need to wear a mask due to a health issue, or you just choose to keep masking, we encourage you to do so. And we ask all Washingtonians to be kind to others who practice this additional safety precaution, whether that is continually or in certain situations or when disease is high. DOH will be ready to provide appropriate PPE. We have on hand 7.5 million high quality masks available for distribution to local governments, healthcare, frontline workers in higher risk settings, schools, and the public. And that is, that is specifically, should there be an emergent need, a supply chain shortage, or both. And then the third area is system readiness. This is about being vigilant and prepared for the next curveball that COVID-19 may throw us. We will continue to monitor all necessary data and use tools to detect any change in conditions that signals a need for a different level or a different type of response. This includes our continued disease detection, things like monitoring COVID-19 cases, hospitalizations, and deaths, like you heard Dr. Lindquist talk about, as well as genomic sequencing and the use of wastewater surveillance to gauge how ongoing transmission is going and what trends we're seeing. We will continue our partnership with the Washington Medical Coordination Center and our state's healthcare coalitions to address health system capacity and ensure balancing across the state so that everyone has access to quality healthcare. We'll also support health system capacity through workforce resiliency efforts and providing critical medical supplies such as ventilators and hospital beds when needed, as well as maintaining an on-hand supply of personal protective equipment for healthcare workers. The third area is treatment and therapeutics. These are also key to preventing severe disease and protecting our healthcare system. And DOH will work to ensure equitable access to therapeutics like antivirals and monoclonal antibodies, with a particular focus on geographic areas and groups that have higher disease burden and reduced access to care. It is really difficult to know when COVID-19 will become endemic or when the pandemic will truly end. However, we do have the knowledge about how to protect ourselves, our communities, and our state from COVID-19. We encourage the community to use all the prevention measures that we've used over the past 2 years and we know work: hand washing, masking, vaccination, distancing, testing, and staying home when you're sick. Again, a quick reminder that tests remain available at the Say Yes COVID Home Test.org portal. And if you test positive and need supports, you can call our COVID hotline to access Care Connects. The number is 1-800-525-0127, then press pound. If you need language access, we have language assistance available on that hotline. The Department of Health is committed to following a path of recovery that empowers people, organizations, and businesses to work together to protect each other. Together, we'll keep our loved ones healthier, our schools and childcares open, our economy strong, our communities resilient, and our state going forward. Back to you, Nikki.
Thank you, Deputy Secretary Birnbach. This brings us to the Q&A segment of today's briefing. First up, we have Ariel with the spokesman review. Ariel, go ahead.
Thank you. I have 2 questions this morning. First, what we know currently about immunity and reinfection when it comes to Omicron, as well as the BA.2 strain of that variant. And then what COVID services, if any, like testing or other strategies that DOH has been using, are at risk of not continuing if federal funding runs out or is not re-upped? Thank you.
Thanks, Ariel. I'm going to turn both of those questions over to both Dr. Lindquist and Lacey, but I did want to just add one additional piece to your second question, which is we are absolutely working with our federal partners and monitoring what's happening at the federal level. And you are absolutely right that a lot of our funding from the federal government has also been able to sustain what we have done in the state of Washington. And certainly we've brought state resources to the table as well, but the federal funding is absolutely critical to the work ahead. So we do want to continue to advocate for those federal resources to the state of Washington. And that is something that we are going to continue to do as we move forward. So with that, let me turn it to Scott and Lacey. Thanks.
Yeah, Ariel, to answer your question about reinfection with the BA.2 strain. So it's a very complicated question because our best indicators of reinfection are when people get tested, they get reported, and then we can say, hey, you had been infected before. A lot of people are getting these new strains, which are very mild, don't even know they have it, or they're getting tested with home tests. So we're underestimating the reinfection rate, no question. But some of the studies that have done show there is significant protection with the Omicron variant and its subvariant BA.2. So because they're essentially the same Omicrons, just a variant, subvariant. So it looks promising. I think we're underestimating our reinfection rate because a lot of people don't know they have it or they're testing with home tests. So it is clearly showing a decline. So whether the reinfection rate is higher than what we are seeing, it is definitely not affecting the case rates. We are seeing a decrease. And Lacey, I'd turn the second question over to you.
Yeah, thanks for the question, Ariel. So, Dr. Shaw mentioned we definitely want Congress to come together and recognize that the pandemic is not over and that we do need to fund ongoing response efforts, both to keep, our state going forward and our nation going forward, and also to help the rest of the globe, because the pandemic does not end until we protect people across the world, really. In terms of immediate impacts to Washington State, the big issue that you're hearing reported is that the White House would not, the the administration they would run out of funding to purchase some of the things that they then supply to states and we allocate out. So boosters potentially, monoclonal antibodies and antiviral therapeutics. So treatment and those types of supplies would become potentially more scarce and not funded by the federal government. Those supplies come to us and then we allocate them out or distribute them or administer them. That is super concerning from a public health perspective. The other piece is that there is an uninsured program that is run through the Health Resources and Services Administration, HRSA, that pays for things like testing, vaccination, and treatment of people who don't have insurance. And that would be without funding potentially going forward. So very concerning. I hope that our national elected leaders can come together and solve this budget issue so that we can keep our nation going forward on this recovery journey, in the most productive way possible.
Our next question comes from Kate with KUOW. Go ahead, Kate.
Hi, thanks so much for taking the time today, everyone. And Dr. Shah, condolences on the passing of your mum. Just wondered if you could give us a little bit more of a look at this forward plan. I think for folks hearing the high level and even the little bit of detail that you provided about what that's going to look like it's tough to imagine. So could you give us just an example of how things might look different or what things might look like kind of on the ground as we move into this next phase and how that's going to be different from the current approach and what that looks like now?
Yeah, thank you, Kate, and thank you for your kind words. I will tag team this with Lacey. Let me just start by saying that, we all recognize that we're at a different point in time with this pandemic than where we have been. Vaccines have been widely available. They've been free. They've been accessible. We've made every effort across the state to be able to get vaccines to people no matter where they are. In addition to that, obviously, we know the importance of masks throughout this pandemic at varying times with levels of transmission that have been up and down. And then certainly, obviously, testing and the importance of people knowing when to test or how to test or what to do when a test result comes back. So what we're doing is, from a commitment standpoint, is looking at what the state wants to, continue to focus on and all the things that we talked about, the elements that we talked about, but also in addition to that, to have supply of the availability, if you will, where we can be supportive and assure that we have those supplies available to the public. So as Lacey mentioned around testing or the ability to have masks in our supply chain. So if there is a surge, we're able to get those out to those focus areas where the supplies may not be getting to. So I think what we're really describing as a twofold element of information, education, and empowerment, and the awareness that goes in so people know what their risk is as they're moving forward, and also to empower them with making good decisions based on the tools that would be available. So one is, when do you get a booster? Number two would be, when do you get tested? Number three would be, when do you wear a mask? Those kinds of things as we move forward. So on the ground, what it would really be is dependent on what's happening in terms of community transmission in a particular community, not as much what's happening statewide, but in a particular community, and really looking at that particular community and also the particular setting or the risk that that individual has from a standpoint of maybe they're themselves with a chronic health condition, maybe they have a loved one with a chronic health condition, maybe they're in a in a facility where it's a congregate setting, for example, a long-term care facility or a nursing home. So it just allows us to continue to provide the information, also make sure that those tools are available. Where the tools are available in the private sector and places where people can access, absolutely. But when it gets to a point where, from a safety net standpoint, that we have to do something ourselves as a state, we move forward to be able to at least have that in our back pocket. And then the final thing is really just for us, as Dr. Lindquist described, is for us to monitor what's happening across other settings, from a variants of concern setting, from all the surveillance activities that would be needed from a disease detection standpoint. And Lacey mentioned newer tools for that. But for everything that we're doing behind the scenes with our public health partners and our other system partners, so that we're ready, we're watching, we're monitoring, and the public can move forward with their activities while they're also being safe with those activities, and keeping in mind that you can do both, that you can be enjoying life and doing the things that we all want to do, but also to be mindful that there is some risk in some of those activities, and we just want to have people be careful and employ those tools when necessary. So I hope that helps a bit, Kate, and I'll turn it to Lacey for anything that I may have left out.
Thanks, Dr. Shaw. I don't think you left anything out. I can just give maybe a couple of examples, where we are in a different phase of the pandemic, and that is largely because of the level of vaccination we have, very recent acquired immunity from that huge surge of Omicron that you saw Dr. Lindquist talk about, or heard Dr. Lindquist talk about. And so on things like vaccination and testing, for example, we're thinking about what is the sort of baseline level of capacity we think we need to maintain for the next several months, but also how do we be ready for scaling up capacity? And there can be different reasons you scale up capacity in vaccines. So a new group becomes eligible for vaccine, or a fourth dose is recommended for certain populations potentially. On testing, it tends to be driven by increases in disease. So, making sure we're being good stewards of public funds, and also that we're ready when we need to scale up or adjust our response. So that's, those are our two quick examples. On antivirals and monoclonal antibodies, these have been in pretty limited supply throughout the whole pandemic. And, we are hopeful that they'll be coming more online in the next month or so. And so, that's actually something like a newer expanded capacity we're working with our teams to build, so that if there's a wave of disease, all of those treatments are accessible across the state for anyone who needs them, and, it fits the clinical recommendations for receiving them.
Yeah, and Lacey, let me just add one additional thing. We have gone through a tremendous amount of efforts in the state, and I mean the entirety of the state, both at the state level and across our local partners, to have one of the lowest death rates in the country. We at last look, we were at 4th, 5th, 6th. So we're in that top 5-ish when it comes to the death rate across the country. And that's something that when Lacey is talking about surge, I mean, we absolutely want to continue to protect people. And this is why it's so important, though, for us to empower people with the information so they know what to do with those tools, right? So if you have a test and somebody tests and gets a positive result or a negative result, and they don't know what to do with that result, that is something that we want to continue to provide information on what to do with those results, so that they can make good decisions as they move forward with their daily activities. So I think that's the key message for us. And then it really gets back to this place where we've talked about empowerment is not just about COVID-19, but it's all the whole host of other things that make all of us healthy, right? Our physical health, our mental, emotional, behavioral health, our spiritual health, making sure, we're exercising and taking vitamins and getting sleep, and, all the other things, all the other vaccines that we want people to, for their children and as adults, and their own, heart heart disease and preventing diabetes and strokes and falls in elderly, et cetera. There are so many things that we want to make sure that people are continuing to focus on in addition to COVID-19. And so it's really about empowering people to continue to remember that it's a whole spectrum of health for the individual and the community. So that all is what we really want to move forward with. And so that's going to be more in the details as they come out tomorrow.
Thank you. We have 4 more reporters in the queue. Next, we'll go to Nicole with Cairo. Nicole, go ahead.
Good morning, everyone, and Dr. Shaw, my deepest sympathies for your loss. I'm wondering, this surge in Europe that's happening right now, it reminds me a little bit of what happened with Delta, where at first it was worse in other areas of the world. We weren't so worried about it here, and then boom, we got hit with it really hard. So how do we know that the same thing isn't going to happen a month or two down the line here? And if that were to happen, I mean, what are the chances that we might see some of these restrictions coming back, and what would those restrictions look like?
Thank you, Nicole, first of all, for your kind words. I am going to turn this one over to Dr. Lindquist. I will say that, one of the things that Michelle and Lacey and Scott and I have talked about is the fact that we are more vaccinated today than we were even during the Delta surge. And so certainly protection is something we want to continue to emphasize to our community members, those who have not gotten their primary vaccines, those who have gotten it but are now eligible for boosters, just to make sure, especially if you have those chronic health conditions and or you're at an older age, we want to make sure that you are protecting yourselves and your loved ones. So I think that's an important piece of this. But Scott, let me turn it to you if you want to talk a little bit about what we're seeing in Europe and across the globe and how that may impact us here in Washington moving forward.
Yeah, and I think first and foremost, I'll have to say we aren't going to be able to predict whether that's going to happen here or not a month down the road. But we have all the surveillance methods in place to look for any new variants and to look for any rise in hospitalizations, cases, or deaths, no question. About half of the countries in Europe are seeing this increase. A variety of different population epidemiology for these countries, like vaccination rates, like variant percentages. What they are not seeing is a new variant, okay? They are seeing Omicron be the predominant variant. They are seeing this expand into areas where people were not infected before. So for us, it could be people that are unvaccinated. So again, like Dr. Shaw said, we know all the tools. Lacey and Dr. Shaw laid this out with forward plan. We have all the tools on how to prepare ourselves and prevent this from going forward. I have a lot of confidence in our ability to look for new variants. We have one of the strongest genotyping programs in the country. We genotype more percentage of our samples than almost every other state. So if we see a new variant coming or an increase in any of the subvariants, we'll be the first to know. And we are not seeing that right now. Like I talked about earlier, people are really concerned about the BA2 or the subvariant of Omicron. It is not proven to be more infectious, more deadly, more serious. And it remains at a fairly low level in Washington state. Yes, we have detected it for a month plus now, but it has not had the rapid increase like the initial Omicron variant. So I think with knowing that we have tools to prevent this from happening, just as a matter of people adopting them, and the ability to do surveillance to make sure we're not seeing it coming is something that I feel very confident about.
Scott, if I could just remind Nicole that, and I may have the dates a little bit off, but it was about 7 or 8 days from the time that South Africa and Botswana had identified Omicron that we had identified in the state of Washington through the genome sequencing, the Omicron variant in the state of Washington. And that's an example and a testament, honestly, to the sophisticated genotyping that we have here in the state of Washington. And so while a lot of states were trying to ramp up, Scott and his team were already on it, and they were confident that they were going to be able to detect. And within a week, that's exactly what happened. So I do want to just remind Nicole that this is not a theoretical. This is really truly that we have baseline capabilities that are behind the scenes, and then we ramp them up when we start to see a need to do so. And that's what we did with Omicron. So that should give confidence to our community members as well.
Question is from Keith with Como. Keith, go ahead.
Thank you, and also express condolences, Dr. Shaw. I took care. My mother-in-law had a stroke for many, many years before she passed on. She was in a wheelchair as well, so I understand the challenge. For Dr. Lindquist, the question that Nicole had also said, is there a chance that we're going to have to ramp up with restrictions, masks going on, and that kind of thing? If this, you're not calling it a new variant, but the BA.2, is that a possibility? And for Dr. Shaw, is the governor's emergency order necessary to stay in place in order to continue to be eligible for the federal funding?
Thank you, Keith. Let me answer that second one first, and then Lacey may have another additional comment there, and then we'll turn it to Scott for your first question. And again, thank you for your condolences. I would say that we are in active discussions and monitoring what's happening when it comes to the FEMA funding and the reimbursement eligibility. And I think that is what is so complicated about this, that many of the funding that is allowing for us to continue our efforts, which I think all of us would agree in our state, we want to continue to be able to protect people, that those efforts are very much about being able to manage within the guidelines or the parameters that the federal government has put out there. And so one of those considerations for the governor's emergency proclamation or emergency orders is very much about making sure that we have access to the funding so we can continue to be able to move forward. One of the big things, Keith, to remember is that we are at this inflection point right now where, yes, things have improved, but what you don't want to do is to have things improve and then you pull off those very measures and those very protocols and those very efforts that have actually gotten us here. And so if you completely pull them off immediately, what happens is that you get a potential rebound, and we do not want to see that. We have gone through way too much efforts in our state, all of us collectively, and we do not want to go backwards. So we want to be very careful. We want to be very methodical. We want to be very, very much reasoned when it comes to how do we look at the road ahead. So that's why the federal funding is so critical to the work that we're doing in our state. And obviously that is also sustaining a lot of those efforts in the public health and healthcare sector as well. So Scott, before you answer, let me just make sure Lacey doesn't have anything she wants to add to that.
I think you covered it. Thanks.
Good. Okay. All right. Scott.
Yeah, so I've got two new heroes here. I've got Keith and I've got Umair, who have taken care of their mothers and mother-in-laws after a stroke in a wheelchair. Kudos to you guys. That is a ton of work. I do understand that. Keith, yeah, just to be very clear, this is exactly what the forward plan has built into it, ability to do surveillance and looking for any new variants or an increase in cases, hospitalization, that would require us to use evidence-based practices if we need to again, meaning worst case scenario, we get a new variant that is way more infectious. We see our case rates go up. We won't be surprised by this. We'll see it coming. We'll pick it up through genotyping. We'll pick it up through our epidemiology, and we will make recommendations appropriate for that variant and what's needed, whether it's a new vaccination, whether it's masking, whether it's, again, social distancing issues. That is all part of the plan going forward, that we have to be nimble enough to actually follow the epi very carefully and not base these decisions on opinions, but base it on facts and science and what we observe.
Our next question comes from Elise with the Seattle Times. Elise, go ahead.
Hi, good morning. Thank you so much to you all for being here, and condolences, Dr. Shaw, as well. I was wondering if, we've heard so much about challenges for healthcare workers and hospitals and in terms of short staffing and lack of capacity. So can you, either Lacey or Dr. Shaw, can you kind of talk a little bit more about if there's any kind of support or longer term planning for healthcare systems capacity in the Walk Forward plan? And then number two, I think, Lacey, you did get at this a little bit already, but we have, of course, seen dips in trends and relaxation of mitigation requirements in the past, only to face new surges. So what is kind of the thinking about the plan being introduced now versus during any previous lulls?
Yeah, Elise, thank you. And thank you for your words. And I will tag team this with both Lacey and honestly Scott from a healthcare provider standpoint. I will say that what I've noted over the last few months with my own mother's care is that the healthcare system is both stretched, but it's also resilient. And there are two things that we are simultaneously happening, and that's really hard sometimes for people who are not in the healthcare system to recognize that. On the one hand, it is stretched; it's very difficult, and those very people that are in the healthcare system who are either leading it and or supporting the clinical care that's occurring are very much stretched, and it has been challenging. But at the same time, they're amazingly resilient. And I will tell you, even talking to the nurses on the very day that my mother passed, or the very night that my mother passed, I will tell you that they had just an incredible resilience and this ability to I'm not sure if the word is compartmentalize, but they were able to compartmentalize or catalog or somehow demarcate what was occurring in their minds and their own bodies and their own spirits about approaching healthcare, but at the same time recognizing how difficult it was. So they were still doing the work and doing that work, but they were also amazingly resilient about it, and still had the smile and the ability to be compassionate, and the ability to still give their patients the incredible care and compassion that they so deserve across the state. And that is not something that was just in my individual setting. Lacey and Scott and all of us, Michelle, all of us have gone across the state, and we have visited with our healthcare systems, from, Western Washington to Eastern Washington, to, areas in between, large jurisdictions, small jurisdictions, large hospital systems, small hospital systems, private hospitals, public hospitals. I mean, we have looked at we've been everywhere to really provide that support. And what we have been just amazed by is the fact that there have been newer strategies that the healthcare system has had to employ, whether it's traveling nurses or whether it's a new way of providing care or therapeutics, a new way of managing loads in emergency departments. But they have done it. And they are amazing when it comes to being able to do that. And so I just want to make sure that we recognize that there are simultaneously two things happening: a stretched and a strained system, and also resilience to the very people who are in that system. Now, moving forward, we want to do what we can to monitor and work with our healthcare partners. And we obviously know from a hospital association standpoint, WSHA, the Washington State Hospital Association, has been very much instrumental, as have been other coalitions and the Washington Medical Coordination Center, all sorts of different groups of collectives of healthcare entities coming together. And we want to continue to partner and work with them. So I don't know if there's a specific here's X or Y or Z that we're going to be doing, but it's continuing to really recognize the importance of those efforts. And that's why getting back to that earlier question about funding and the federal support is so important, because we want to continue to sustain those efforts as we start to move into a new direction here with the pandemic. So Lacey, I'll turn to you.
Yeah, a couple of quick additions. One, we have throughout the pandemic and in surges and continue to support a volunteer system for healthcare workers that matches people willing to volunteer. Well, they can also be hired, I want to be clear, but willing to come online either back from retirement or even from another state. So we will continue to do that. And to the earlier question about a state of emergency, our ability to do reciprocity with licensing in some cases, and the necessary onboarding of those healthcare workers is protected by the state of emergency. So that is another reason we want to keep that in place. We also you might recall that during Delta, we brought on a GSA contract for a number of healthcare staff that ended up supporting dozens of hospitals and healthcare facilities across the state. Many of those hospitals and facilities have now formed direct contracts with some of those entities. So to help with their staffing challenges, as Dr. Shah mentioned, we're regularly working with the Washington Medical Coordination Center and our healthcare coalitions to really balance the system. And we do that for COVID, and we do it for other reasons as well. So that work would continue. And then to your timing question, Elise, like why now? Something, I think as we started our descent from Delta, we were thinking about what the long-term might look like for COVID. And also, I think many of us recognized it was going to be a pretty challenging and uncertain winter with just respiratory virus season, not knowing what flu might look like in the year. And so I think the combination of going through that huge Omicron wave, being at the time of year where a lot of respiratory viruses start declining, seeing our trends for COVID over a typical year, it did seem like we have a good opportunity now to paint at least a several month view of what our response and journey through the pandemic might look like. And I do think something we've talked a lot about being ready for the next wave. I think the other thing we really want people to focus on is this is about hope and seeing hope on the horizon and moving forward and healing from this really, really, catastrophic time our society has been through over the past 2 years.
And I'd like to leave this on a positive note. So during this pandemic, one of my daughters went back to nursing school and graduates next month. And I have seen the hope within this group of students going into healthcare who have lived through this horrendous time, have done their formal training during this time, and are still eager and are very supportive of the healthcare system. As Dr. Shah said earlier, I have complete faith in our healthcare system here in Washington State. It is resilient, it is flexible, it is creative, and as with my own daughter, it has hope. There is a new group coming forward from this.
Our final question is Sally with the South Seattle Emerald. Sally, go ahead.
Thank you for taking my question, and condolences to you, Dr. Shah. I want to ask a question of Michelle, perhaps, in regard to boosting. I just want to be absolutely certain. I have a screen capture from the demographic breakdown of those boosted in Washington State, and please confirm for me. It looks like both Black and Hispanic residents are below 50% boosted. So I have a follow-up. If you'll just confirm that I'm reading, there's pale, purple, and dark blue, and the boosted percentage.
Yeah, Sally, we'd love to look at that data together with you. I think let's look at that together offline, and we can make sure we're interpreting what's on the dashboard correctly together. So, but you're right, we do have race ethnicity data for booster doses on the website, and there is differences and
Yeah,
gaps.
below half. So if I'm standing in a classroom that's majority Black or majority Hispanic, the protections and hope that we've just been talking about really don't exist in terms of the immunity that I can expect for the rest of the people in that room.
Yeah, well, you're raising a really great point, Sally. That's super important. When we talk about our high levels of vaccination, they're not equal across the state. Geographically, they're not equal among different populations or among different age groups. So there are areas that have higher vaccination rates and areas that have lower vaccination rates. So this raises a couple of things. And those areas and those gaps are present in all communities across the state. So in fact, in some of the geographic data, it's pretty concerning when you're looking at it at a county level. The gap between our counties with the highest rates to our counties with the lowest rates is 50%. So that's really significant. That's why we continue to talk about the importance of vaccination, why we continue to offer vaccination services, why we continue to especially make sure our efforts are culturally and linguistically appropriate and work on our equity efforts to close the gaps. Lacey mentioned you'll see that in our forward plan, and why we're continuing to work with community partners, fund community partners to do outreach and education within as a trusted messenger within their communities, and why we offer services like the caravan to come into communities. But you're absolutely right. Everybody's individual risk is going to be kind of factored in about what settings you're at and what may the immunization rates be within your setting. And so we'll continue to, you'll see in the forward plan, to make sure vaccine is readily available and work on strategies to continue to try to close those gaps.
Thank you to all of our media partners. If you have follow-up questions, please do reach out to us at doh-pio@doh.wa.gov. This concludes the question and answer segment of our briefing, and now we'll go to Secretary Shaw for closing remarks.
Thank you, Nikki. I want to thank our communications team, as always, for their hard work behind the scenes. I also want to thank Dr. Lindquist, Michelle, and Lacey for joining this morning. And I want to thank all of our media partners, as always, being there to provide good, accurate information to our community members. As I mentioned at the beginning, this is a very difficult time for those who have lost during this pandemic. And we have to continue to remember that this pandemic has not been without cost to everyone. And that means that we have to continue to keep our attention on keeping people safe and protected. That said, we're pleased to be releasing the WA Forward plan, and we do believe this is an opportunity for us to be looking at the future. What that future holds may be uncertain, but we know what's certain is that we are going to continue to protect Washingtonians. And so I just want to thank everybody for your continued efforts. And I also want to just remind everybody, again, to be respectful of the rules of the room, what the safety protocols that may be in your individual context, or as the last question that Sally asked, just the reminder of how important it is for people to also take those steps to protect themselves, their loved ones, and ultimately their communities. We will continue to go forward as a state, and WA Forward is an opportunity for us to do just that. And so please be well, please be safe, please be healthy, please protect yourselves and your loved ones. But most importantly, please remember that we're on this together, and together we will continue to move forward. So with that, Nikki, I will turn to you to close.
Thank you, Dr. Shaw. This concludes today's media availability. I'd like to thank our panelists for their time today, and TBW for hosting today's live stream and archives of past briefings. Thank you to all, and take care.